All right,
All right. I think everybody knows who I am and what I do and why I'm here, so I'm not gonna go into all that. So, we're here today to do MedPass administration in service, and we're gonna do this for two reasons. It's good review to get into practice with the Department of Health and what they look for, plus it's stuff that we normally should be doing anyway, so in case you forgot some things or maybe got into a couple bad habits, I just wanted to go over the basics so that we're all on the same page. So when the Department of Health comes on their annual inspection, they're required to do a MedPass audit on several nurses, and what they look for is they look for medication errors, things that you do that aren't technically what you're supposed to be doing, and then they divide out the number of errors that they find on while they're watching you, and divide it by the number of opportunities. And if this number comes up 5% or more, it's considered you're out of compliance and the facility will get a deficiency. Also, they look for significant medication errors, which are things like maybe warfarin was given to the wrong resident, or something that directly can impact the resident adversely. You're only allowed one of those, and that will get you in the facility a deficiency. So that's how they score you. Does everybody kind of understand how that works? I mean, probably most of you have already been reviewed by the Department of Health and you know exactly how it works. So I want to go into some of the medication principles that we normally should be doing on a regular basis. And the cornerstone is the 6 rights of medication administration. We want to make sure we have the right resident, the right medication, the right dose, the right formulation, the right route, and the right time. You also want to make sure you're checking the label directions against a MAR prior to administration. You verify the medication strength, dose, and any special directions like shake well, give with food, do not crush, refrigerate, etc. Medications need to be administered in a timely manner. That means that you have the 1 hour rule. 1 hour before the designated time on the MAR, before, and 1 hour after. So if you have a 9 a.m. medication, the allotted time that you have to administer that 9 a.m. medication is 8 o'clock in the morning to 10 o'clock in the morning. So anytime you're outside of those parameters, let's say you give it too early or you're dragging on and it's going too late, technically you're out of compliance and they can say something about that. You want to make sure that your resident ingests all their medication prior to going to the next resident. You want to make sure that they're not saying, "Oh, leave it with me, I'll take it later," because it's your responsibility to know that the resident took all of the medications. And obviously somebody can pocket something in their mouth and kind of fool you, but you really should not go on to the next resident without making sure that all of the medications are ingested. If a medication is not available from pharmacy, please do not get into the habit. What sometimes happens is clicking not available from pharmacy, because the Department of Health is trained to look for not available from pharmacy, not available from pharmacy, not available from pharmacy, passing down the buck from day to day. And if they find several of these in a row and nobody followed up to see what's going on, because maybe there was a problem, maybe the order didn't get faxed, maybe the order did get faxed but the pharmacy never received it. So we need to figure out why we don't have medications as soon as possible and not leave it for the next shift or the next day, because if these pile up, they're trained to look for it and they hone in on that and they will get you for that. And they have, I've seen it several times, not available from pharmacy being an issue. Hand washing. I don't think I need to go into this much with all of the hoops and that we went through earlier, but know your facilities, policy and procedure for hand washing and use of antibacterial gel. Is there anything new regarding that?
We are getting them in the room. They'll be in every medicine cabinet in the room. The door and the window medicine cabinet, the pumps. So you'll be able to use the pump.
Do we have a policy that states between X amount of residents we can use hand gel versus?
Tammy's working on that right now. She's incorporating that into, she is condensing the incontinence and wound procedures, and she's gonna have competencies December,
Yes. beginning
of December on that, and then that's when you'll see when you can use the hand gel and when you have to really wash your hands. So that's coming up.
Okay, very good. Vital signs, know your facilities policy for procedures for taking vital signs, whether it's monthly, weekly, and watch out for those medications with parameters. A lot of our blood pressure medications will have parameters, hold if less than systolic is X amount, or pulse is less than 60 or whatever. Make sure you're keeping an eye out for those. We don't wanna miss those. Always make sure you wipe your stethoscope with alcohol after each use. That can be an infection control issue, and it's that's a thing that they look for. Moving on to crushing medications. Crush only medications that can be crushed. There should be a do not crush medication reference in each medication book. So if you have any question on whether a medication can or cannot be crushed, you can look it up there, or you can call the pharmacy if you have a question regarding do not crush. Medications generally that are do not crush are enteric coated, like enteric coated aspirin, EC is the designation. Usually anything that is sustained release, which has a designation of SR, XL, extended release, XR, all X, I'm trying to think what else they use, but there's a number of designations, and the reason is because those medications are in a special formulation where they break down inside the body slowly in time release. So if we go ahead and open up the capsule or the tablet and crush it, we're actually compromising that coating, and instead of being released over a longer period of time, we're ruining that integrity, and it could be could result in what's called dose dumping, and that's when all of the dose goes into the body all at once, and that can cause problems. So that would definitely be a medication error if you crush something that you shouldn't have crushed. You also want to make sure that you never touch medications with your bare hands. You can hand them to the resident if they want you to do that, but never, once you touch a medication, you should throw it away because it's considered contaminated. Offering adequate fluids is a biggie. The definition of adequate fluids are 4 to 8 ounces of fluid. I actually did a med pass several years ago where the nurse did not offer any water to the residents to take their pills, and they were actually half choking on it. So I don't know whether she forgot or whether she got nervous because I was following her or what, but the definition is 4 to 8 ounces of fluid. IDing residents is a huge thing. Obviously, it's one of our 6 rights to make sure we have the right resident. So IDing a resident with either a picture ID in the med book or whatever you have, and or a ID bracelet around the resident's wrist. But really, even if you know the resident, you should go through the motion of checking either a picture or a bracelet if that's what you have. Preserving the resident's right to privacy. You want to make sure you cover your MAR when not in use. Knock on the resident's door prior to entering the room. Just don't barge right in because that is their private room, and you really should be knocking on the door, identifying yourself and why you're there. Just the nurse wanting to administer your medications. Avoid medication administration in hallways, dining rooms, especially with invasive type medicines like eye drops, ointments, inhalers, injections, nasal sprays, patches, treatments, medications through the feeding tube. Also, you don't want to really be taking vital signs out in the out in the open. Some exceptions can include medications would need to be administered with food, so then you could give them in the dining room, or at the resident's request, or with a doctor's order to administer medications in the dining room. But other than that, we really should be avoiding public administrations and vital sign taking. Observe the resident's right to privacy. Oh wait, I already did that. Wait. Cover. I have that down twice for some reason. And I think I messed that up when I was cutting and pasting. Didn't pick that up. Observe the resident's right to refuse medications. Residents always have the right to refuse medications. If this happens, you need to go back and try again later. If they still refuse, then you can label the medication as being refused. And you want to also inform the doctor that they're refusing medications so that they can possibly make changes or tell you that it's not a big deal. But if you know the resident is refusing medications, medications are important and the doctor needs to be in that loop of what's going on. So if there is some changes that they can make, they will make them then.
We also need to notify the families too.
You do?
Yeah.
Wow.
Yeah.
Okay, medication carts. You want to make sure they're clean, neat, organized, stocked with necessary supplies before the start of the medication pass. Controlled substance drawer should be locked at all times, and the entire cart must be securely locked anytime, and this is important. I want you to remember this. When your cart is out of your visual control means you can't see it, or you can't see somebody in it. Now, obviously, if you're standing right next to the cart doesn't need to be locked because you can see somebody getting into it. If you're around the corner or in the med room or in somebody's resident's room, it needs to be locked because it's out of your visual control. And we have a lot of residents roaming around, potentially taking things out of the cart, maybe ingesting them, and which would be poison to them if they are, it's not their medication. So remember that buzzword, visual control. And you also never want to leave medications for the same reason on top of the cart unattended, because somebody can come by and take them. Now I want to change gears just a little bit and talk about medication storage compliance. Department of Health surveyors can and do look in medication carts and medication rooms. The following items must be maintained to avoid deficiency. Medication carts and the room refrigerator must be free of expired medications. Know which medications have a shortened expiration date, and I included in your packet the shortened expiration date list that I made up earlier, and that tells you when you open an insulin how long it's good for, and it should be dated and then thrown away upon the shortened expiration date. Also, PPD injection has a 30-day expiration once you open it and use it. Xalatan eye drops are 6 weeks. They may be taken out of the refrigerator and used in the med cart, so that needs to be a 6-week expiration date. Advair discus. A lot of people don't know this, but once you remove Advair discus, which is that purple, it's about that big and it's purple, inhaler out of its sealed pouch that it comes in, it's very air sensitive, and it's stable only for 30 days once you take it out of that pouch. So that's why you should date it and throw it away at 30 days. Now the good thing about Advair is that it's twice a day and there's 60 inhalations in there. So if you do the math, in 30 days you should be done unless they go to the hospital or they refuse or something happens. But generally you should be done with that Advair at the end of 30 days. PRN eye drops. Now generally eye drops don't expire until the expiration date that is listed on them, which could be 1 year, 2 years, maybe even longer. But good nursing practice is 6 months. So generally your eye drops are for glaucoma, they're routine, they don't last 6 months. But you do have some orders probably for PRN eye drops for artificial tears, maybe some allergy eye drops, maybe Pantanol or something like that, or Visine. But we should really be dating these upon initial use and getting rid of them and reordering them if we still have an order after 6 months, just because they could be contaminated. You know, maybe we touched the eye during administration earlier, and that, you know, that little bit of eye liquid got in there and maybe started growing something. So the good nursing practice is 6 months on your PRN eye drops. All medications must have a pharmacy label. The exception would be stock medications. So make sure if you, for some reason, have an unlabeled medication, we look into why it's unlabeled and get rid of it if we can. Medication carts and medication room refrigerator must be free of discontinued medications to avoid overcrowding in carts. Please remove and dispose as soon as the order gets discontinued. This is a tough one because we need to be really on top of getting rid of discontinued medications. I spent a lot of time over the summer getting rid of medications that, PRN orders that we have accumulated over time. And I suspect that, you know, our carts are always seem to be full of medication. I suspect there is some in there that maybe does not have an order. So we need to stay on top of this and get rid of it as soon as possible. So first of all, there's no order. So if we gave it, it would be a medication error. And second of all, it's crowding our carts. We don't have any room. Multi-dose vials including insulin, eye drops, oral inhalers, nasal inhalers, ear drops, and liquid should be dated upon initial use. And the reason why is, we talked about earlier, sometimes they don't last until the expiration date, so that's when we should date them upon initial use. Medication room refrigerator must be 36 to 46 degrees. This is what the USP defines as refrigerated temperature for medications. I don't know whether you have a daily control, a daily temperature log, but if you do, and you look at it, and if it's out of this range, the temperature you know, if you write down 29 degrees for the refrigerator, you need to take a next step and adjust the thermostat so that's a little bit warmer, so that you try to achieve 36 to 46. Controlled substances must be counted and Q-shift count sheet signed by 2 nurses. Looking at this recently, I've noticed some missing signatures. They're not always there, so we need to follow up on that. And if there's any discrepancy, it must be reported to your supervisor as soon as possible. Let me tell you, it's crazy out there what's going on in healthcare. There's missing narcotics. I'm constantly getting calls from places letting me know that stuff is missing and we need to do in-servicing. And so stuff is walking out of facilities left and right, so we really need to be vigilant with making sure our counts are correct. Just roll on the last page, I want to look at special administration procedures. Oral solid medications, things like proton pump inhibitors, Carafate, and Reglan are all examples of medications that should be administered prior to meals. And then on the opposite way, non-steroidals like Mobic, ibuprofen, and then steroid medications like prednisone should be administered with food because that lessens their potential for adverse effects. So you really should be, you know, we especially assign times to our proton pump inhibitors here because the majority of them need to be administered on an empty stomach. And so if you are kind of out of your window and you are administering of that and you're administering it as they're eating, it could be an issue because those medications really need to be administered before a meal. Oral liquids, you want to make sure you always pour liquids on a flat, hard surface like your med cart and measure at eye level or measure with an oral syringe. I see a lot of measuring going on up here. That's not going to really cut it, you know, because especially if it's a narrow therapeutic index drug like Dilantin, you want to make sure it's on a flat surface and that you're measuring from the bottom of the meniscus, which is that usually a bow-shaped liquid level. I want to shake all suspensions. Anything that is designated suspension should be shaken before use. Another example would be Dilantin suspension. If you go to give Dilantin suspension and you don't shake it, and the surveyor's watching you, that is considered a medication error. So always remember, that's probably the #1 medication that needs to be shaken. You want to pour away from the label. Obviously, this if it gets on the label, it starts getting drug buildup on it, and you can't really it'll obliterate the label over time. KCl liquid is a perfect example of something that needs to be diluted. If you were to give potassium chloride liquid undiluted to a resident, it would be a medication error because it specifically states it needs to be diluted with water. Medications via feeding tube, check for platelet placement and patency before, flush with at least 30 cc's of fluid before and after administering each medication unless there's a doctor's order that says you can give medications together. So we have to be aware of our PEG tubers. PEG tubers, G tubers, enteral tubers, whatever you want to call them, are huge targets for the Department of Health. They actually ask who has a PEG tube, and they specifically try to watch you during the med pass on those people, because there are special things that you need to know, this week being one of them, as far as making sure that your flushes are correct. Injections, wear gloves, state all multi-dose vials, which we talked about earlier, swab the top of the vial before entering the needle with alcohol. Warm and roll, do not shake insulin before administration. Shaking it will actually break up the particles in the insulin, especially the cloudy insulin, and it'll make the insulin less effective. You want to rotate and record injection sites, discard used needles in the sharps container always, and injecting cold insulin, and I want to reiterate this, injecting cold insulin, let's say you take it out of the refrigerator and you inject it into a resident, not only is it painful, but it can cause tissue necrosis. So you always want to make sure that your insulins are warmed up, probably a good half an hour, 45 minutes out of the refrigerator before you administer them. You probably could warm them up in your hand a little bit too if you had to, if you're really pressed for time. Transdermal patches, remove the previous patch, that's a huge one. How many times have you seen multiple Duragesic patches on somebody, and Duragesic still has drug in it, even after 72 hours, so you could overdose a resident. Apply to only intact skin. It shouldn't be rashy or cut or anything like that, and the area should be free of hair. Rotate and record administration sites. This is particularly important for a lot of our patches coming out now require a 14-day administration. You need to administer at a different site, not more than once in 14 days. Things like Exelon patch, Nupro patch, they actually state that. So I don't know if we have anybody on those medications right now, but if you were to go left shoulder, right shoulder, left shoulder, right shoulder, that increases the risk for a sensitivity reaction to the skin, and a surveyor may ask you to look and check your patch rotation to make sure there's no more than one site used every 14 days. Oral inhalers, shake well. Separate multiple inhalations by at least 1 minute between puffs, and this is whether it's the same inhaler or whether it's a different medication with an inhaler. So if you have 2 albuterols, you want to do 1 puff, wait a minute, and then do a second puff. If you have, let's say, Advair and Spiriva, you want to make sure that you administer one, wait a minute, and then administer the other. Always, and this is a little less important now, bronchodilators before steroid inhalers. You always want to make sure that you open up the airway before you introduce the steroid inhaler, so the proper order would be the bronchodilator like albuterol before the steroid inhaler like I'm trying to think of one now and I can't. Flovent. You also want to make sure you rinse the resident's mouth out with water, or ask them to rinse it out after any inhaled corticosteroids like Advair, Symbicort, Flovent, etc. The reason why is because if you do not rinse your mouth out with water after administering those, it increases the risk for thrush or oral candidiasis, which is yeast growing in the mouth. So if you get that drug out of the mouth, it decreases the risk for developing thrush. Ophthalmics, you want to make sure, just like inhalers, it's 1 minute. Remember, eye drops is 3 to 5 minutes, and I always like to go 5 minutes on eye drops. So whether it's the same eye drop or whether it's different eye drops, you want to make sure in between drops if there's a 5-minute wait. And the last thing I wanted to talk about was behavioral flow sheet documentation. And a little bit of time we have left, and we'll take some questions if we have any at the end. Psychoactive medication used to treat behaviors require a behavioral intervention form to be filled out by the medication nurse every shift to ensure regulatory compliance. These forms should have at least one target behavior specific to the resident and monitor for a number of behavioral episodes, any interventions, outcomes of the interventions, and any side effects observed. So what I'm talking about is this blue form that we use here. Antipsychotic medications, things like Abilify, Haldol, Risperdal, Seroquel, Zyprexa, must have a blue triangle behavior. And what I mean by that is on the back of the form, there's behaviors that you can pick from that may be specific to what your resident is. And the reason why we need to pick a blue triangle behaviors is because they are strong enough behaviors to justify the use of an antipsychotic medication. And these are just some examples. Now, there could be something else that you could pick that the resident does. And the test is that behavior strong enough to pass the test of, is this something that can cause harm to the resident or somebody else? So obviously something like kicking, slapping, hitting, spitting, throwing, physical abuse, verbal abuse if it gets bad enough, those are all things that are appropriate for an antipsychotic. Things like insomnia, restlessness, anxiety, those are weak behaviors and do not justify the use of an antipsychotic. So we want to make sure we have strong, accurate, what I mean by accurate is to that specific resident, because every resident is different with their behaviors, that we're monitoring for. PRN psychoactive medications require multiple non-drug interventions documented prior to administering the medication. Now, we've actually circumvented that with this form by doing it through Optimus. So any PRN order for a medication that is used to treat a behavior, whether it be PRN Ativan, PRN Ambien for insomnia, PRN Xanax, really should have a non-drug intervention reminder added into the order so that we are documenting that, because I believe a couple years ago we did get hit on that. And also, this form is designed to pick up potential side effects. And next to your blue triangle behaviors, there's a whole list of potential side effects for specific groups of medications. So nursing, you really should be familiar with psychoactive medication side effects and report any observed side effect to the attending physician as soon as possible. And there is a side effect box underneath all of your documentation on that day. And what's good about it, it says blank box indicates no side effect observed. So obviously if you leave it blank, that's documentation that you did not see a side effect. If you do see a side effect, like somebody's tremoring, that just started tremoring because they started an antipsychotic, that's when you want to write down the side effect and you want to make sure the doctor's aware of something like that. Because these antipsychotics do have a potential for causing serious side effects, so we need to let the doctor know as soon as possible if we are observing any of those side effects. Does anybody have any questions? I know we went over a lot of stuff. A lot of the stuff should have been review, but maybe you picked up a couple things that maybe you got out of habit with or didn't know. Yes, Randy?
You have a lot of blank spaces on that page one.
That's why we're having this in-service. We need to shore that up. Especially on the second page, a lot of times we forget to turn it over and there's a behavior, a third behavior on the back. Making sure that you're turning over the form because a lot of our blanks are on the number 3 behavior that I've seen. Any other questions?
The PRN psychoactive,
Yes.
so does that have to meet the same requirements as the above listing where it has to be a danger to themselves or others to use them?
Well, generally we don't use PRN antipsychotic medications. And the blue triangle boxes are antipsychotic medications. So usually our PRN medications are either for sleep or anxiety, and they do not, you can use anxiety or insomnia there, but we shouldn't be using them for antipsychotics.
Okay. You also mentioned about not handling, like not touching the pills themselves.
Yep.
If you have to take a capsule apart and put it in applesauce, do you have to have gloves on then, or since you're not touching the inside, is that all right?
You're discarding the capsule because, you know, obviously you don't, you know, you're
They're not
throwing that away.
Yeah.
So you're allowed to touch that.
Okay,
So, yeah, that would be
That would be
okay.
all right.
That would be one example of where you could touch it.
is it enough food with these, like say ibuprofen and the others, the cup of applesauce that you might put it in?
Really, it should be administered around a meal, meaning that prednisone at 9 a.m. should be administered after breakfast, or, you know, if you're doing a PRN ibuprofen,
Mhm.
and it's, let's say it's 2 o'clock in the morning, you know, obviously you're not gonna have a meal, so make sure they have adequate fluid, which is 4 to 8 ounces of fluid, and maybe a little bit of extra applesauce, so that, or
Okay.
milk even, if you have that available, or whatever. You know, something to coat their stomach so that it's not corrosive to the stomach.
So that little, like maybe more than you would normally give.
I would
for
probably
applesauce.
bulk up on them, you know,
Okay.
in that instance, if you could.
And you talked about enough fluids with the medication.
Uh-huh.
It made me think of one resident who refuses to drink.
Well, you
after
can't,
a
like,
cupload of pills.
just like
So
you-
should we document that he does that, or?
I don't think you need to, but let's say a surveyor was watching you, they probably wouldn't say anything if you offered 4 to 8 ounces of fluid and they declined. You know, you can't make somebody do something, so, you know, I guess, the way I had it, the way I listed it is offer adequate fluid, they don't have to drink it all, no.
Okay.
But you should be offering it, so, you know, you could say that at least it was there if they wanted it. Anything else, Jess?
If you are giving someone 10 cc's of Colace,
Uh-huh.
can you put that liquid Colace in a liquid water, juice or something for them to drink, or do they have to drink it straight? Because I know some people, it
It
burns their
burns,
throat.
yeah.
Always put it in water,
Yeah, I don't think it would be wrong to put it in water.
as long as they drink it all.
Yeah.
Does it have to be water though? Cause like
You
I'll put it in
juice
juice or something.
I've never heard that being an issue, so I would imagine
Masking medication issues has come up before too,
masking medication.
like trying to hide
Hide
medication in
food
the
or
juice.
something.
That's a good question.
Guess you could say, here's your Colace.
I mean, I would try to administer it to them straight, and if they say something like it burns my throat, or I, you know, ask them, would you like it in water or juice? And if they say yes, you know, go ahead and do it, you know. Don't assume something, you know what I mean? Anything else? Anything at all? Going once, going twice. Next group,
Thank you.
thank you for your attention.